I started treating scoliosis patients early in my career, and as a result of this was because I had a very large family practice, and I was seeing lots of families coming in for chiropractic care, and I would see patients that had scoliosis. And I was doing what I was taught to try to help these patients, but what I would notice is that these curves would continue to progress and worsen, despite my efforts in trying to reduce them using general typical chiropractic approaches. And I became frustrated, so I started seeking out what are the best ways to actually try to reduce and manage the scoliosis, and I started gaining certifications and knowledge to try to help these patients, because there's nothing I feel that's more offensive to the spine is other than spinal fusion, where you put rods and screws up and down your spine and you limit all function of the spine in a child. So this is something that deeply disturbed me, and I really wanted to find a root way of actually treating this process. Now we don't know what causes scoliosis in the majority of patients. However, over my 30 years of experience, we've actually noticed that there's a very significant way to treat a scoliosis, and we've seen patients respond very well. And conversely, as I continue my career, now my current wife and also one of her children actually has scoliosis, and we actually treated my stepdaughter's scoliosis and prevented the curve from ever progressing. So all the knowledge I gained over the period of my years, I was able to apply into my own family and actually stop the curves from worsening and ever becoming significant, where the patient was actually recommended surgery. And this was during critical stages of growth and development. So I know firsthand that what was involved with this, and our goal is to try to prevent scoliosis progression and try to prevent patients from having scoliosis surgery.